Yes, we're joined now by Dr. Chris Luke. Good to have you again, Doc.
Hi, Dahi.
You have more gadgets,
more props.
high-tech gadgets, might I add, with you today.
Particularly high-tech this week,
Loads of stuff in the papers, especially today, about the winter vomiting bug. Tell us about that. How can you spot this for us, as opposed to the obvious thing of people getting sick?
Winter vomiting virus is actually called norovirus, is the modern name for it. It was always known as winter vomiting because it seemed to strike traditionally in the middle of the winter. It's a tiny virus which is very, very contagious. I mean, it spreads, rapidly like wildfire. And it normally resides in the gut, but something about this time of year makes it particularly infectious. And of course, it was well described in lots of epidemics in cruise ships by the Americans over the last 15 years, which is where it got its name, Noro. And basically what they found was that one person would go into the cinema on the cruise ship and would perhaps vomit or whatever in the cinema. And if the cinema wasn't thoroughly cleaned, over the next 4 or 5 days, hundreds of the cinema goers within the cruise ship became very sick.
Is it airborne then?
It's basically particles, droplets on the surfaces around someone who's vomited, obviously particularly around kitchens and toilets.
And is it just vomit, or is it if you sneeze? I mean, how is it actually?
No, it's actually diarrheal and vomit as well. And of course, the key thing is to wash your hands. And basic hygiene, which is why I brought these two things to remind us, is that, I mean, this is the #1 agent. These are the number 10, these are the top 10 vectors of transmission, the 10 fingers. And basically, the most important thing probably is simple bleach, but lashings of bleach all around any area that has been potentially contaminated by vomit. So obviously, the whole of the toilet, not just in the vicinity of the bowl itself, but all around the toilet.
It's not enough just to wash it. It's not enough just to flush the toilet or that.
Detergent and warm water is not enough. That's the preliminary wash.
Okay.
Then you must use a lot of bleach, use your gloves, and wash your hands before and after the process.
Okay.
Doc, we got an email in here from a lady called Laurie. She got the vomiting bug 3 weeks ago, and she had it for about 2 or 3 days. Her son got the vomiting bug last Tuesday. She's after getting it back again now, and she feels very, very weak. She thought that you could only get this once. Is that true?
That is unusual, because you do tend to become immune to the virus. Now, having said that, we did talk about whooping cough briefly, and immunity is not 100%. So that's an important point. Immunity may be 80 to 90% for any infection. So it's possible that she did not become immune, or that she has a different kind of complication, or that she has a reaction to perhaps antibiotics or anti-inflammatory she took, or that it's a different virus, because there are other viruses that cause this gastroenteritis.
Well, Laurie, we hope you get better, and your son as well.
Yeah, and I suppose the only thing about it, as the doctor is saying, it only lasts a couple of days. Take us through this. The symptoms you feel first, how you feel them, what happens, and when you get out of it.
Well, if you come in contact with a surface that has the virus on it, and the virus is very resilient, it withstands cold and heat and drying out and so forth. It's very, very resilient. It's a bit like a spore, and it's also very contagious, which means that you only need tiny amounts of it. They say up to 100 of the viruses, which is a tiny dose in virological terms. And if you then transmit it with your hands into your mouth, you then may become very sick within 1 to 2 days. So the incubation is 1 to 2 days. Now, it then tends to be a 2 to 3 day wonder.
So you will be throwing up regularly?
Well, the hallmark is bloating. So classically, and we've heard a lot about this in the last week or so, people on a bus or at a bus stop become increasingly aware during the morning or the afternoon of being bloated and a little bit uncomfortable. And unfortunately, it can go up or down. So you can have upper gut, which is kind of indigestion or sore upper belly, or you can have diarrhea.
So north or south of the border?
North or south, precisely.
Is this why you've got this beautiful paraphernalia?
Which is why I remind you of my austerity first aid kit. Not only should you keep the paracetamol, age appropriate, the children's or the adults, in your little bag, but I would suggest that for anybody who might be vulnerable to sudden abrupt onset of vomiting,
north of the border,
very handy. So keep that first aid austerity kit in your handbag or your briefcase.
Should you take something if you have diarrhea, which can be very serious? Should you take something for that?
The most important thing is really flat lemonade.
Flat lemonade or 7-Up.
It has a little bit of sugar, it has a little bit of salt, and it had lots of fluid. So what you're trying to do is replace the fluid and the salt and the sugar.
Why flat, though?
Because the bubbles, carbon dioxide, are said to be not very good for the tummy, actually.
Okay.
And should you eat it? Should you just stay away from eating until this
Well,
goes
I mean,
away?
for many years we had this sort of milk-free diet for babies with gastroenteritis. Then we realised that when we looked at it, it wasn't actually particularly effective. So the bottom line is you take whatever you can keep down, and that might mean very clear soup or scrambled egg, something very delicate, something very bland.
Experimenting as well, I suppose.
But the most important thing is to make sure you are rehydrated.
Okay. Somebody's got in touch with us here. It's a Geraldine McCardle, and she's asked us to ask you about the fear of vomiting. The actual fear of vomiting. Is there anything that you can do with that? She said, I'm so scared about the winter vomiting bug, and she's got an actual fear of vomiting.
That's not an area of expertise of mine. I'm just used to people who just get on with the vomiting.
Yeah, that you have no choice, actually, I suppose, really, when it comes to this.
Say, look, vomiting is an evolutionary function, and it has been designed by the body to repel and expel poisons. Yeah. So the reason we vomit is because the stomach recognises that something is very bad for you. So it may be an acid or an alkaloid or whatever, and the body recognises with its sensors in the stomach, this is bad for me, this is toxic, get rid of it.
Okay. And do you need to take to the bed for this bug, or can you actually function?
Well, I tell you what you should really do is you should keep to yourself. Now, we've had people, I've just come from the hospital, and we've had people coming in vomiting in our waiting room and in our clinical areas, and I would say to you, we have nothing extra to offer you, and unfortunately you are threatening the health and safety of lots of other patients in the waiting room and in our clinical area. So please do not come to the doctor or the hospital unless you're very, very ill.
A&E, because Chris is an A&E consultant.
I work in the emergency department, but please don't come to the hospital unless you're very, very ill.
But we often hear of the bug being inside the hospital sometimes as well, and for people to stay away.
Yeah, well, I mean, hospitals are potentially dangerous places, so people shouldn't visit willy-nilly. They should respect visiting times and so forth, and they should come in as few numbers as possible. Sometimes we're overwhelmed with visitors, 2, 3, 4 per patient in already overcrowded departments. But just to finish my point, it's very important to stay away from other people. So if you're a child, stay away from the creche, stay away from the school until 3 days or so after you've stopped feeling sick and stopped having diarrhea and stopped vomiting.
Because you're still harbouring the virus for 3 days.
Correct. And that you're shedding it is the word, that you're shedding the virus. And the key thing is to stay away from work or school or creche until you're better.
Well, I mean, looking at the papers today, and it was full of the fact that thousands of people are going to lose work days over this. And I mean, unfortunately, it's very difficult for people right now to stay away from work because a lot of people won't get paid for that. Is that just the bar of regular soap?
These are the answers, basically. Okay. Hand hygiene, washing your hands dozens of times a day, certainly to any contact with other human beings, and lots and lots
cough into your elbow and all that stuff as well.
Absolutely, all that kind of stuff.